So we're here at Project Labcoat, where Lyme advocates, patients, researchers, doctors, and celebrities are going to be walking to raise awareness for Lyme disease. And I met a new friend. So can you say hello and tell our listeners who you are and where you're from?
Hello, I'm Michal. I'm here from MIT.
All right, so can you tell us what you do at MIT? Because we absolutely love researchers and brilliant people like yourself. So let's geek out a little bit and tell us exactly what you do and how you're helping the Lyme community.
Sounds great. So I'm an immunologist, which means I look at the immune system and I'm trying to understand the immune response to infection, why it's, how it's different in males and females, and why females are more likely to go on to chronic illness after infection. I'm trying to understand why not everybody bounces back from an infection. And so I have, in my lab, I have both a mouse model of chronic Lyme as well as a huge clinical study that's going on comparing Lyme and COVID, and what's similar about chronic Lyme and long COVID and what's different, and really trying to understand, the people can tell us that something's wrong and they feel that a lot of things are wrong, but we don't have good measures that can be used both for biomarkers, for clinical trials, to decide treatments, and so we are trying to measure everything in our clinical study, everything. We collect samples like blood, saliva, sweat, vaginal swabs, saliva, like anything that people are willing to give us, we collect.
And people listening donate. So if somebody's listening, whatever it is, do you need more samples, and how can people donate samples if the answer is yes?
Well, so the study happens on campus at MIT. So, most of the people who participate in my study are in the Boston area, and we are in the stages. We're in the final stages of my study right now of completing our cohort. So, please go ahead and try to enroll. You can find my website, Tal Research Group.
T-A-L?
T-A-L.
Researchgroup.com.
It's at mit.edu.
Okay.
Or on a website, maybe .mit.edu.
So if we just Google Tal Research Group, you should come right up.
Tal Research Group,
and
MIT,
we're going to do show notes,
yes.
so depending on if people are seeing this on YouTube or our podcast, we'll have a link in everywhere we publish this, so we'll have that covered.
Great.
Yes.
Great, perfect.
I have a few quick questions.
Please.
I know that there are some companies that are trying to make, some LFA kind of point of, assay for Lyme, but I know that one of the biggest issues is just how many different markers there are. Like, are you having a hard time with the mouse model trying to keep up with that or develop them?
So let me try to explain a little bit about what we're after. So if an antibody is a Y, and this part binds to different markers, right? So there's a lot of different things that we look at as, for example, in the Western blot, you would be looking for, different OSP proteins. You would be looking at different proteins like, P41, P66. There's all these different markers. That's this part of the antibody.
And that's outer surface proteins that are part of the Lyme bacteria.
That are part of the bacteria that cause Lyme. Right now, the stem of the antibody, this is the part that binds to immune cells and recruits different immune cells and tells different immune cells what to do. So in our study, what we're doing is we are making ratios based on the stem. So we're looking at the antibody a totally different way. It binds to Borrelia, it binds to the bacteria, however it binds, wherever it binds. What we care about is what ratio of different stems are you making so that we can ask the immune system an open-ended question. Currently, when we do these clinical tests called serology, we're asking the immune system a yes-no question. Have you ever seen this before? Yes or no? And then we literally just count one type of antibody. What we're doing is we're asking the immune system an open-ended question that is, if you ever saw this bacteria, how did you respond? Did you respond in a way that was protective, or did you respond in a way that was catastrophic? And so those are the
Catastrophic means
ratios.
excessive, like almost like an autoimmune.
No, well, there's many flavors of catastrophic. So catastrophic could mean it's bringing on dysautonomia, it's bringing on gynecological diseases, it's bringing on allergic diseases, it's
So
bringing
one
on...
pathogen can cause a variety of responses by the immune system.
Exactly.
And from me to you to Emily, it could be different.
Correct.
Okay.
Correct. And so we're measuring all these different flavors of catastrophic responses versus people who are making a protective response, in which case you can say, okay, great, you're going to have antibiotics and you're never going to worry about this again, versus the people who are really at risk for developing long-term illness, so that we can identify them sooner, so that we can intervene sooner.
That is so interesting. Okay, so also could like what you're working on also kind of, and I'm sorry, but would it help with like personalized medicine?
That's so.
Is there a different area?
No, so this absolutely helps us personalize in terms of, you know, one thing that we're looking at is, are there people with chronic Lyme who have more similarities to people with long COVID than people who have chronic Lyme that's manifesting in a very different way? And so one thing that this allows us to do is to more personalize your treatment in terms of, what if we understand that your problem is coagulation, right? So the blood is getting really sticky and clotty and you have all these clots causing trouble. That tells us what therapeutic direction to go in, versus if we see that you have mast cell activation and you're breaking down your collagen and you're falling apart, that tells us we need to go in a different direction, and there's different ways that we can stabilize that. And so really kind of delineating what type of catastrophic response is happening in response to this infection can really help us target therapies, not to the level of personalized as in you have your own, not like making a CAR T cell, but personalized, but more personalized in terms of, we don't expect there's going to be a one-size-fits-all cure for Lyme. Yeah.
So is that like, I have chronic Lyme, you have chronic Lyme, I'm expressing it with severe inflammation and autoimmune-like symptoms, but you're having extreme GI-based issues.
Inflammation is this big umbrella term. So I think the best way to think about it would be, we're asking what type of inflammation.
Got it. Got it. So let's pull back, because I feel like that is extremely common. Almost everybody with chronic Lyme has inflammation. Would you agree?
Agree.
Okay, in some shape or form.
Agree.
So now you're able to identify what specifically is contributing to that from an immune response standpoint, and then help practitioners determine what can be helpful in treating that very specific, unique case of Lyme disease, because we're all different from an immunological standpoint. Is that fair? And you can tell me no and tell me why I'm wrong and help me clarify.
It's more group than that. So
Okay.
we're not trying to get to the level of how exactly are you personally responding, and then we make a special treatment for you that fits only you.
Okay.
No, it's how are you responding so that we can group you with other people who are responding in that type of manner. And then, you know, there's several custom treatment strategies, but that could fit a whole subset.
So what bucket do I fit in when
What
it comes
bucket
to
do
how
you
I
fit in?
respond?
Yes.
And that bucket can inform
Yeah.
doctors about how to treat that patient with pure data that they wouldn't otherwise have had if it weren't for you and the work that you're doing.
Yeah,
Okay.
exactly.
Got it. So we're gonna have to do a follow-up, because
I love it.
we can talk
I
for 2
love it.
hours,
Yeah.
and I'm so happy to have met you, and we're gonna do a follow-up
I'm
long form
glad to
podcast
have
as long
met
as you're
you.
willing.
All right, to
And
be continued.
Thank you so much.
Absolutely.
But in a nutshell, I just want to
Yeah.
say, so Dr. Tal, correct? I'm saying your name correctly?
Yes.
Dr. Tal, you're going to be giving, and you already have given this community hope, because in the end, there's a lot of people suffering. And these people suffering want to know that people care about them, and they're doing work to help them feel better, and they feel like they're going to be sick forever. And what you just said has given us hope that that's not the case, and that we're going to have a better future for these people. So thank you so much for that.
I want you all to know that my team at MIT are working so hard. I have a crew of really, really dedicated scientists who are working so hard on this. We have so much support at the university. A lot of people care. A lot of people want to help. So,
yep, and my
please know
final
that.
final comment, Dr. Tal, is because we're going to do a follow-up. If somebody is seeing this on any platform, look in the show notes or the description of whatever video you're looking at, because we will post a link to the full podcast so everybody watching can go and geek out with us even more. So again, thank you so much, and thank you for coming tonight to help us raise awareness.
Thank you. All right.